Now, Dan, in your first intervention, you said not everything can be measured, okay, or can be translated into numbers. Now, can I ask you again? Can I ask you? I mean, if you think and how quantitative and subjective information can be integrated into quantitative analysis?
Okay, and following on from John, the question I really asked Luca to plant was, at this point in the hour, who would like to be camped now for the bar while we're still awake, or who would like to stay here? I'll answer your question. I think there's a handful of ways that this kind of information can be integrated. The kind of obvious one is to sequence qualitative and quantitative kinds of work. Qualitative work might be done to try to frame the context, to try to inform the definition of variables, to define the range of answers, etc., and basically feed into the development of a good quantitative instrument. Or alternatively, once a quantitative survey or measurement exercise of some sort has been done, qualitative information can be quite useful to try and put it in context, or to try to answer some of the puzzles that come up out of the statistical analysis that may not be directly answerable by the statistical analysis, etc. So I think that's one way they can be integrated. I'd like to throw out a couple of other ones. One of the things that Mark mentioned in his earlier discussion was the principle of parsimony. And something that we've experimented with has been to ask people questions directly about some of these indicators and outcomes, rather than try to construct a fancy and more objective index. So this kind of gets into the subjective indicators part of the discussion. For example, in some work that we did in northern Ethiopia here over the last couple of years, one of the things we were interested in doing was a sort of a technical comparison of a number of food security indicators. And just to answer this question, we threw in a very subjective self-assessment, i.e., were you, over the last, whatever the time frame was, 3 months, I guess, how would you rate your own food security? Were you food secure? Were you slightly food insecure? Moderately, etc., without giving any definitions of those, just in people's own perception, how did they assess their own food security status? And we did a similar kind of a slightly longer term livelihood self-assessment as well. Interestingly, when we got done with all the data collection and did the analysis, one of the things that we were worried about was people might see this as an opportunity to sort of game the system and paint a very bad picture, hoping that somehow or other our results would find their way back to the World Food Program or the PSNP or something. And it might result in a better allocation of resources to that community or even to that household. Interestingly, when the results came out, the self-assessment measure was right in the middle of 6 or 8 more objective measures. It didn't give the highest prevalence estimates of food insecurity, it didn't give the lowest. But more interestingly, it tracked over time exactly the same sort of pathway that the other indicators, the more objective indicators, went. So, and that was a question that literally took 5 seconds to answer, 5 seconds to put into the computer, and 5 seconds to analyze. And it came out with actually a fairly mid-range kind of estimate. Another one that we did at IFPRI a number of years ago, when there was a brilliant epidemiologist called Saul Morris there, was we had an entire battery of questions around child health and health-seeking behaviors and symptoms and feeding practices, etc. But Saul came up with the idea of taking a line that was 10 centimeters long, showing that line to the mother or the caregiver of the child, and saying, could you please, considering all the children in your community, could you please make a mark on this line to show where you think the health of your child compares to all the other children in the community? And if you think your child is the most healthy kid in the community, put the mark clear over at the right-hand side. If you think your child is the most unhealthy kid in the community, put the mark clear over to the left-hand side. And otherwise, put him or her somewhere along that line. And then each enumerator had a 10-centimeter ruler. They measured and gave a number. So highly quantitative, but very subjective information. Saul showed that information was as good a predictor of child health outcomes as numerous of these other kind of indicators. So here's a way that, sort of following the parsimony principle, some of these indicators might be used in. And if I haven't overrun my
you did, but
time. Okay, thanks. I usually do. It struck me during, not the previous session, but the one before that, where people were reporting back from the different kinds of shocks, the different sub-sessions that have been done earlier in the day on different kinds of shocks, that we're still sort of treating shocks as though they can be isolated. In other words, we can talk about droughts, or we can talk about floods, or we can talk about price shocks, or we can talk about epidemics. But in point of fact, of course, if you look at the real world, you get droughts on top of conflicts, on top of food price shocks, on top of measles epidemics. And when you do that, you get the Somalia famine of 2011. So somehow or other, we've got to be able to combine these things. And I'm not sure that we quite have the means to do that quantitatively yet, but I think qualitatively, we've got to begin to sort of look at not only indicators of resilience, but also the impact of shocks cumulatively.
Okay, then thanks a lot for the practical example and illustration that you did. Just one point, just maybe for the following discussion. Maybe when we move to the debate, it will be very also interesting to hear maybe from some of the participants here some experience on this area. When you were describing this your approach, I could not stop thinking of the work that WFP, UNICEF, and FAO have been doing jointly in Somalia, in which the quantitative and qualitative methods have been combined in order to provide better information to decision making in the very famous resilient joint program of the three agencies. So maybe I will ask some of the colleagues here to say something about this.